Here's a pro tip that can make a real difference in your Social Security disability case. Don't overlook your emergency room and urgent care visits, especially if your condition involves flare ups. A lot of people think only their primary doctor or specialist records matter. But in reality, those unexpected trips to the ER or urgent care can be some of the most compelling evidence in your file. Why? Because they capture your condition at its worst. If you're dealing with something like chronic pain, autoimmune conditions, migraines, respiratory issues, or even mental health episodes, flare ups can hit suddenly and severely. And when they do, you may need immediate care. Each of those visits creates a medical record that shows intensity, frequency, and urgency, three things that the Social Security Administration looks closely at when evaluating disability claims. For example, if you've gone to the ER multiple times in a year for severe back pain, asthma attacks, panic episodes, or other symptoms, that pattern can demonstrate that your condition isn't stable or manageable enough for regular work. It also helps show that your limitations aren't just based on what you say, they're backed by real-time medical intervention. But here's where many claims fall short. Those records don't always make it into the file, or they're not clearly connected to the overall story of your condition. That's why it's so important to include those visits and make sure they're presented in a way that shows the bigger picture. How often flare-ups happen, how severe they are, and how they interfere with your ability to function consistently. At Disability Advocates Group, we work with clients to identify these kinds of gaps and make sure every relevant piece of medical evidence, especially ER and urgent care visits, is properly included and explained as part of a strong, cohesive claim. If you have questions about your situation, call Disability Advocates Group at 800-788-2095 for a free consultation, or take a moment to use the free SSDI screener at ssdianswers.com to see if you may qualify. This video provides general information about SSDI. It does not constitute legal advice.